Hi, everyone. Thanks for joining us tonight. I'm Mark Bradshaw.
And I'm Neely Jones. News Channel 8's Maureen Wartz is live tonight with a look at what may be ahead for Oklahoma. Maureen?
Neely, health experts are saying we're averaging around 700 brand new COVID cases each day here in Oklahoma. And if people don't start wearing masks or social distancing, then there might be targeted shutdowns, which is what you see happening in other states.
This has been a challenging week for our state.
From 1,075 new cases in one day to the head of state announcing he's tested positive.
I didn't have a fever, but just a little bit achy, so just did my regular testing, and it came back positive.
Health experts say COVID-19 is rapidly spreading in Oklahoma.
700 new cases are being confirmed in Oklahoma each day, and that's a lot of cases. Remember, there was a time not that long ago that we were in the 60 to 70 new cases on average per day.
Dr. Dale Bratzler is the chief COVID officer for the University of Oklahoma and says about 8% of COVID cases in the state are folks who work in hospitals, which is causing a problem.
So I would argue that we're actually starting to strain hospital capacity at this point. And sometimes it's not about how many licensed beds you have, it's how many nursing staff and others you have to actually staff those beds.
The Center for Public Integrity is reporting that an unpublished White House task force document listed Oklahoma as one of 18 states that should roll back reopening measures. And though Governor Stitt has said repeatedly he won't be issuing a statewide mask requirement, Bratzler says some things need to change now.
I would say in general, if we all took personal responsibility, wore a mask, did the physical distancing, and tried to avoid crowds, I think we could stem the tide of this without going back to complete lockdowns.
Bratzler saying this week has been a big one for Oklahoma, and big changes need to start happening now for things to turn around. Now, Bratzler brought up the idea of herd immunity, which is the idea that so many people would become infected with the coronavirus that the majority of folks would be immune. And he said that is not a possibility, because if that were to happen, so many more people would die from the virus. Reporting in Tulsa, Maureen Wartz, News Channel 8.